Today I'm going to talk about a procedure called TAVR, TAVR, which is Transcatheter Aortic Valve Replacement. And before explaining the procedure, I will be explaining some anatomical aspects of the heart which are relevant to this procedure. Now, as all of you know, heart has 4 chambers, 2 on the right side, 2 on the left side, and each one has a valve in between the upper and the lower chamber. But the valve which we are going to talk about today is another valve which is called aortic valve, which sits between the main pumping chamber of the heart, which is the left ventricle, and the aorta, which is the main artery into which the left ventricle pumps the pure blood and then it goes to the body all over. Now, the valve which sits between the left ventricle and the aorta is called the aortic valve. And this particular valve is vulnerable for certain disease processes, the most important of which is age-related degeneration. Now, generally as the age advances, particularly after the age of 70, this valve starts degenerating in many patients. And then it gets calcified, and once it becomes very stiff, it cannot open as well as it should. Now, when that happens, the left ventricle cannot pump adequate amount of blood to the body, and with this the patients start getting into some problems. Now, this particular disease where this aortic valve cannot open properly is called aortic stenosis. The word stenosis means narrowing. This new modality of treatment becomes very handy. Now, in this particular treatment procedure called TAVR, the procedure is done under conscious sedation. Patient is generally not anesthetized unless there is a special reason to do so. Procedure is done through the groin. Give local anesthesia in the groin, and through a large bore sheath, the valve is delivered across the opening between the left ventricle and the aorta. Now, the question that will pop up in the mind is, what happens to the patient's diseased valve? So we don't do anything to that valve. We just keep it as it is. We keep it there, and the new valve, which is a bioprosthetic valve, which is mounted in a system, goes across this tunnel between the aorta and the left ventricle, and patient's native valve is crushed and compressed against the valve, and the new valve sits in that place. Now, in the accompanying cartoon, we will show how it fits there, but this is in short the procedure. So generally the procedure takes about a couple of hours, one and a half hour to 2 hours, and patient immediately wakes up after the procedure. Blood loss is generally minimal. There is no need for giving any blood transfusions, no anesthesia, no stitches. Patient is generally shifted to the ward within few hours and is discharged within 24 to 48 hours. So this is in stark contrast to what happens with open heart surgery. This is a boon for the patients who are very sick and who have a significant risk of cardiac surgery. Now, the important thing to remember is until recently this particular procedure of TAVR was indicated for patients who were high risk for open heart surgery, like patients who were elderly, who had bad pumping of the heart, very severe form of aortic stenosis. But nowadays this indication has been extended to people who are at even low risk for surgical procedures. So to make the long story short, any patient with symptomatic calcific aortic stenosis or symptomatic severe aortic stenosis is a candidate for this procedure.